to think of cataracts if you think of the eye like a camera. So there's a lens inside your eyeball that focuses light on the back of the eye, which is called the retina, and it's like the film in your camera, okay? It's what lets you see. Now, a cataract is like looking through a dirty windshield or looking through a dirty lens with like lots of smears on it. So the back of the eye, or your seeing part of the eye, is looking through a dirty windshield. Cataract surgery is where we as surgeons go in, we basically remove that dirty windshield, and we put in a clear one. So it's like taking out the dirty windshield of a car and putting in a clear one. Cataracts stop glasses from working as well as they used to. So glasses go on the outside of the eye, okay? And the retina is your seeing part of the eye, and you're still looking through that dirty windshield, okay? So the glasses on the outside don't help anymore because you're still looking through that haze. With cataract surgery, that haze goes away. So cataracts is a natural clouding of the lens of the eye as you age. So proteins in the lens of the eye just become cloudier. So one of the first symptoms people get with cataracts is they have problems driving at nighttime. So we call it glare. So just those headlights from the side cause the vision to go down. And it can cause glasses to prescriptions to change more frequently than they normally would. So some patients will come in and their glasses have just changed every couple months. And that's one of the other signs of cataracts. Cataracts are diagnosed in the office. So it's all based off your symptoms. So are you having glare at nighttime? Are things just not as clear as they used to be? Can you not like read things that you used to be able to see? And then we look at how well we can correct you with glasses, so your best corrected visual acuity. If you have glare symptoms or like problems driving at nighttime, we can do a test called a BAT test or a glare test, and it tells me what happens to your vision when you're looking with lights from the side. So a lot of times the vision will go down when cataracts are involved. And then I use a special machine in the office called a slit lamp, and it's basically like a big magnifying glass, and it lets me see the cataract, see what type of cataract you have, and based off the grading system of it, I can see how much it's really affecting your vision. So you need cataract surgery when the cataracts are affecting your daily life. So if you can't see at nighttime anymore, then you need cataract surgery. If you aren't able to see what you used to be able to see and it bothers you on a daily basis, or maybe you can't do what you love anymore, like play tennis, then you need cataract surgery. It's all based off you or how much the cataracts are affecting your way of life. So there's a lot of options for cataract surgery now. The technology is actually extremely great in our field. There's 3 main lenses out there. One is a multifocal lens or multifocal lens implant, and it lets you see multiple distances basically. So it lets you see distance, intermediate, which is like a computer, and then up close, which is, reading, seeing your phone. And there's 2 types of multifocal lenses. One that you need what we call like a perfect eye, meaning no back of the eye problems, no major dryness on the front of the eye. The eye has to be pretty perfect. And then there's another multifocal lens. There's a little bit more give to it that you can use in patients that have some changes in the back of the eye. There's lenses that are called astigmatism correcting lenses. So some people have their eyeballs where they're shaped more like a football than a basketball, and that's called an astigmatism. So we have lenses or lens implants that can actually correct that astigmatism. And then there's something called a monofocal lens. So it only lets you see one distance. So let's say we correct a patient for far away or for distance. Then they would need glasses to see intermediate, which is your computer, and then up close, which is reading or seeing your phone. So recovery is actually pretty quick. You're able, so right after surgery, it's not like you're at home in bed in pain. You're walking around. You can do a lot of your normal activities. The big things that you can't do after surgery are, we don't want you to heavy lift for 2 weeks. We don't want you dunking your head underwater, so like pools or swimming pools, and then no rubbing the eyes. People are a little bit sensitive to light right after surgery. They may be a little bit blurry right after surgery. May feel like a little bit dry or scratchy sensation, but there's no like frank pain, and you can see pretty quickly right after. It takes a couple of days to get the best vision, but right after surgery there's a huge difference.